Okay, I'm Dr. Bharat Dalvi, and I'm attached to Sir H.N. Reliance Foundation Hospital and Breach Candy Hospital and SRCC Children's Hospital, as well as to Glenmark Cardiac Center. And my basic interest is in treatment of children and adults with congenital heart defects, meaning thereby they have defects of the heart right from birth. And in this specialty, I have a even more specialized interest in trying to treat these patients with non-surgical techniques, or what we call as the transcatheter techniques. So this is without opening the chest, and these are done through a small puncture in the lower part of the body or from the groin. So this is what I am. So basically, congenital heart diseases are of multiple types. You can have a hole in the heart, or you can have narrowing of the valve, or you can have leakage of the valve. And what makes things even more complex in birth defects is that these hearts have multiple defects. So they come in combination. You have holes with narrowing of the valve. You can have multiple holes. You can have narrowing and leakage in the valve. So, and sometimes even the heart chambers are abnormally located so that the right side of the receiving chamber opens into the left-sided pumping chamber, so on and so forth. So that is what makes it so very complex. And as far as the incidence is concerned, I think incidence is more or less the same. It is close to 1%. But given the population, I think every year around 250,000 children are born with heart defects in our country. And I think amongst these, at least 1/3 will require some form of treatment. So around 80,000 to a lakh of patients. And given our current resources and given our current infrastructure, I think we are able to take care of at least around 35,000, which 20 years back was as low as 8,000. So we have made a tremendous progress in terms of taking care of these children. So basically, there are problems at every level. Why there is so much of discrepancy between the number of cases and the number of patients that we actually are able to offer treatment. So first is access to health care. So that is not uniform everywhere. And there are many places where the access is not easy. And because the access is not easy, the diagnosis gets overlooked. Sometimes it remains undiagnosed. Second is also the parental education and the socio-cultural or socio-financial background from which they come. So they don't have money to probably go to the physician or go to the healthcare centers to access healthcare. As a result of which the diagnosis gets delayed, or sometimes it's never diagnosed. So even after you get diagnosed, many of these conditions require a highly specialized care. So you need to get these patients to these specialized centers. So there is a problem there of traveling from remote places to these specialized centers, because these specialized centers are concentrated in most of the metropolis, and that too mainly in northern, western and southern India. There is a lot of still lacuna in the central part of India as well as in the northeast. Still not many centers. And then even after you get referred to these centers, many of these centers have so much patient load that these children remain waiting for a long period to get their treatment, and sometimes the things get complicated and these children succumb. Also, there is a cost consideration because these treatments require significant money. There are a lot of schemes available, the government, central government schemes, the state government schemes. There are a lot of philanthropic organizations in India who really donate a lot of money for these children. But still, it's not enough to take care of the entire burden of congenital heart disease. I think we currently may be having 60 or 70 centers. We require for our population maybe 150, 200 centers or even more. We require maybe 2 to 3 times the number of cardiologists and 2 to 3 times the number of cardiac surgeons, despite having made so much progress in last 20 to 25 years. Yeah. So I will talk about a couple of myths more than realities, and also realities. So first and foremost is, as I said, the incidence of heart disease is around 1% in the first baby. Now, suppose the first baby has a heart problem, and if it is not a syndrome with a heart problem, then usually the chances of second baby getting a heart problem goes up from 1% to 3%. So it's not all that much. Still 97% of the babies will be born with normal hearts. But if 2 children are born with heart problems, then it increases in geometric progression. Then the third baby will have a 25% chance. So that is how it increases exponentially with the subsequent pregnancies. Now, some of the myths are that, that congenital heart disease means most of these patients will be bedridden, even if you do something. I think that's one of the biggest myths. I think 80 to 90% of these heart diseases can be treated safely and effectively, having near normal, I'm not saying normal, but near normal quality of life, and many of them near normal longevity. 80 to 90%. Yes, 15 to 20% of the patients do have very complex problems, and despite surgical and transcatheter management, they may have a compromised lifestyle as well as compromised longevity. Now, the second thing is that most of the parents think that babies cannot be intervened or operated at a very young age. So they tend to wait, thinking that baby must grow up to 2 years or 3 years. So that's one of the biggest myths. Now the technology, the experience and expertise of Indian pediatric cardiologists and cardiac surgeons has gone to an extent that you are able to deal even with children who are few hours old. And some of these conditions need to be dealt with at the right time. Because if you wait too long, you can end up with permanent damage to the lung arteries or to the brain or somewhere. And then treating a heart problem becomes almost an impossibility in some cases, or will not have the same benefits that you would have if you were to treat them earlier. So I think these are some of the myths and the realities, and the most important reality is that we in India are now able to really cater to these children and give them an excellent quality of life and longevity. We have many centers and many good physicians and surgeons.